Previously on LSK121, we showed you how to take an STL file and print a 3D model with eGums from EnvisionTEC. And you asked how we get the analogs into the finished 3D printed model, and Luke heard you. Here's the how-to with LSK121 Dental Tech Tyler and Master Dental Technician Luke Kahng.
So on this one we have two different type of analogs. We have a Zim or a BioResin 3.0 and the 3.5. Both the 3.5s are going to go in the middle here. So you can see on the analog here, you got an arch,
Okay.
the archway, and that will actually fit inside to this one right here as well. So this one is 3.5.
Uh-huh.
Just gonna put it right here in the arch.
So you sandblast it?
Yeah, sandblast the bottom just because we cemented them into another one first.
Mm-hmm.
So we are going to take those out, push it into here. If it'll go inside this. And that will go inside here. Okay.
So we need a hemostat just to
Right
make sure
here.
all the way up. But how
And then
can
you-
you tell which one's done, which is not done?
You can tell all the way up. It kind of sits into, there is a little groove right there, and you can see it sitting in there.
Okay.
And once it sits in there, we will cement it and get it. Also, if you have a soft tissue, you can check your soft tissue on the model, and there is actually a ring around the soft tissue. What will show you also where that analog is supposed to stop.
Okay.
If you look at this soft tissue, we have another one. You can see that ring around all of them.
Oh, okay.
So yeah, once that ring will line up with that little line right there. We've got another 3.5 what we're going to put in the middle here. Push that through with the hemostats. See, that one's stuck in.
Yeah.
Yeah, that one's stuck in that little spot.
Yeah.
I'll do the last two on the outside. But
Sometimes we watch the design, model printer design too, right?
yeah,
Check the tissue height.
yeah, you have to see where it's in the design of this. This guy, we'll pop it in.
3. Okay.
Oops, that one flew out.
Yep.
We'll get that
3
one
is
back in.
done.
The fourth one. Make sure that's
Okay.
all the way in the bottom, which it is.
Okay.
And then,
Then we
See the
flip
four
back to
analog
the
here?
tissue.
and then our printed soft tissue as well. It's a soft tissue.
Awesome.
Then, yeah,
Cool.
here's our
Good job.
model.